Most people in this group know what palliative care is. So what I plan to do today is only to draw your attention to some of the key features before we discuss a couple of practical issues related to palliative care. We all know that palliative care is the care of the incurably ill, the elderly, and the dying people. The important point here is that we are talking about the illness and not just about the disease. A disease is a biological dysfunction, but the illness is what the patient experiences. So we are talking about illness and not just the disease. There are many factors in addition to the pathology of the disease which contribute to suffering and the experience of the illness. This obviously means that we have to look beyond the medical and nursing interventions to keep the patient comfortable and at peace. What you see here is the World Health Organization definition of palliative care. Many more definitions have been suggested after this. I think the WHO definition continues to be closer to the holistic approach in palliative care than many of the newer definitions. It talks about prevention and relief of suffering. As a healthcare worker involved in palliative care, you will be seeing people with incurable illness. Since a cure is not possible, you are looking at only at two questions. The first question obviously is how can we use our skills and knowledge to reduce this person's suffering? The second question is how we can make sure that the society, the community, the people around this person know how to support this person. Addressing suffering in a patient will mean addressing the physical issues, the emotional issues, the social issues, and the spiritual issues. All these domains are interconnected, and all these domains need to be addressed to cover the illness experience. The conventional medical domain covers symptoms associated with diseases. Medical science, modern medicine, now has the know-how to address most of these symptoms. This is immaterial whether the disease is curable or not. A healthcare professional should acquire this skill, acquire the knowledge, and should be able to effectively apply it in clinical practice so that the patient can be free of symptoms. For example, these 11 symptoms have been identified as most prevalent ones in advanced cancer. Controlling these symptoms are not particularly difficult if the treating physician knows how to do it. We have a tendency to focus on cancer when we talk about palliative care. But we should understand that non-cancer conditions can also cause as much suffering as cancer in the last phase of life. If you look at this data on the last 1 year of life, you can see that heart diseases and stroke cause as much problems as cancer for the patient. This diagram, which shows the disease-wise split up of people in need of palliative care, is based on 2017 global data. You can see that of all the patients in need of palliative care, only 28.2% are people with advanced cancer. The majority are people with various other diagnoses. We were talking about the need to control symptoms to make the patient comfortable. The second important domain of care is that of emotional support to the suffering patient. The healthcare professional should know how to do it as part of the basic clinical skills. We should also remember that the patient will be spending most of his or her time with family, friends, neighbors, and colleagues. It is important that the people who spend time with patient should know how to support the patient emotionally. Social determinants of suffering are linked to the socio-economic and cultural background of the patient. These would have been minimal if the society in which the patient lives is socially cohesive. A socially cohesive society is one working towards the well-being of all the members. Such a society offers equal opportunity to all the members. Unfortunately, we don't live in societies like that. We should know that social determinants contribute in a big way to suffering of patients with advanced diseases. Spirituality. Spirituality is about the meaning in life. Some people connect this with God, others do not. Whatever be the conviction or belief system, it is important that the patient finds a meaning in his or her life. Even somebody with a very short life expectancy should have a reason to live. We need to help the patient to find this reason, purpose, or meaning in life. As palliative care workers, there are two basic questions before us. The first question is about the individual patient. How do we make sure that this particular patient is comfortable and at peace? The second question is about other palliative care patients in the community. How do you make sure that all such patients in our region are comfortable and at peace? Now we move into groups to discuss a couple of issues. This is the first question. It's about an individual patient. You already have the format for responding with you. Each group is to discuss one aspect of the problem. Discuss in your group and come back to share your response. How we can deliver the care better than now is the second issue for discussion. Discuss in groups and come back to share your comments. You need also email the group's response to us. Thank you.